Hello, my friends. This is Dr. B, the best doctor in medicine. 30 plus years of experience in medicine. Dr. B today wants to talk to you about stroke and how you can decrease your risk of having a stroke, right? Remember that statistically in America and most of the world, the number one cause of death by far everywhere in the world is a heart attack, cardiovascular disease, a heart attack, especially heart attack, right? What we call in medicine myocardial infarction. Number two is cancer. Everywhere, all around the world, the number two cause of death is cancer. In the US, the number three cause of death, and also all over the world in adults. I'm talking about adults, no children, no neonate, no nothing, right? Is COPD. Number four, COPD, chronic obstructive pulmonary disease, right? Because of smoking, air pollution, blah, 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 blah. And it doesn't matter whatever the catso you smoke, whether it's a cigarette or marijuana, all this nasty stuff, or vaping or blah, blah, blah. Those are not safe. Don't fall for this garbage that marijuana is safe. Ooh, vaping is safe. No, it's not. It's nasty carcinogen, nasty stuff they put in those vapes, right? And of course, air pollution, right? COPD, number three cause of death in the US, adults, right? Adult death. Number four is trauma, right? Car accidents, getting shot, falling from the tree and you die, blah, blah, blah. I mean, you get the point. Trauma, right? Being electrocuted, blah, blah, blah. All this stuff is a trauma. Number four cause of it. Number five is stroke. Stroke in the United States is number 5, right? On the causes, the etiologies in medicine, the causes of death. How can you decrease your risk of stroke? Obviously, everybody knows that you need to lose weight, right? Obviously, you need to decrease your blood pressure. You need to stop your smoking, right? You need to take care of your diabetes, right? I mean, these are basic stuff that you can do to decrease your risk of stroke, right? But number one, of course, high blood pressure. Get rid of that high blood pressure. Take your medication. Control your blood pressure. Stop smoking, right? Obviously. Control that diabetes, right? It's killing you from within. High blood pressure and diabetes, the two silent diseases, hidden diseases, right? They are killing you slowly but surely from within, right? And of course, stay away from all this processed food and carcinogen and blah, 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 right? Also, very, 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 very important, about 10 to 15% of strokes are caused by a plaque, a thrombus, right, developing in the carotid arteries. We have two carotid arteries here on this side in your neck and here on the right side. Right side, left side. Two big arteries that carry blood, take blood, food, oxygen, nutrients, everything to your brain, right? 10 to 15%, think about that, of strokes, ischemic stroke, right, are caused by a plaque, right, that detaches, or an embolus, a clot, or both, the clot mixed with a plaque, that detaches and goes to your freaking brain and causes obstruction. Pay attention. Imagine this is a plaque in my carotid artery, right? It's going to detach, go into the artery of my brain and plug it, right? Causes what we call in medicine embolus, E-M-B-O-L-U-S. It's a clot or a plaque that migrates. Sometimes the plaque is together with clot, is this gooey, nasty gooey of cholesterol and calcium that deposits over time in your carotid arteries. Then they detach and they migrate, they go into an artery of your brain and they cause a stroke. Number 5 cause of death in adults in the US. 10-15% of strokes are caused by that. So you can decrease your risk of having a stroke not only by treating this high blood pressure, diabetes, losing weight, smoking, nasty stuff, but also by having a screening, a carotid artery. These two arteries are called carotid arteries. Carotid artery ultrasound, right? We call that carotid ultrasound screening test, right? Carotid ultrasound screening test. If you are, guys, 50 or above, especially if you have risk factors, high cholesterol, diabetes, freaking high blood pressure, smoking, cigarette, weed, blah, 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 you have to go talk to your family doctor, internist, your general practitioner to refer you to an imaging clinic, to a vascular ultrasound clinic, to any clinic that specializes in cardiovascular disease, diseases of the heart and the vessels, like the clinic where I work. Dr. B is an expert in cardiac and vascular imaging. I know the heart and the blood vessels. I know medicine like the back of my hand, even better than the back of my hand, right? So then you come and I put the ultrasound probe on each side. It takes 10 minutes, right? And I tell you, if you have any freaking plaques, right? Some plaques are not dangerous plaques, right? Some plaques are dangerous. Then they need to be treated, right? But you need to know freaking if you have any plaques, right, in your carotid artery. Dr. B, I'm 50 years young. When I take the probe, the ultrasound probe, and I look at my own carotid arteries, they are beautiful like a baby. Because I watch my diet. My cholesterol is that of a baby. My blood pressure is that of a baby. My hemoglobin A1C is that of a baby. I have no body fat, right? And I eat only once a day. The rest of the time I take little snacks of nuts, right? Olive oil, blah, blah, blah. Little snacks, right? My breakfast is a regular black breakfast, no sugar, no fat, no nothing, but small. And then at lunch, I either skip the lunch, right, or I have a tiny little snacks of nuts with a little bit of olive oil, some green tea, coffee without caffeine, right? And at night, it's just a protein juice and little snacks. No dinner, official dinner, no freaking lunch like I used to when I was younger, right? So my cholesterol is so healthy. My sugar, my blood glucose, my hemoglobin A1C, my blood pressure, everything. I have no freaking plaques, right? It is possible that the insurance company is not going to cover for that screening, ultrasound, carotid screening ultrasound. So you have to ask your doctor to find an excuse like, oh, the guy feels dizzy. Oh, the guy has a headache, blah, blah, blah. Your family doctor can do that so that you can get the approval by your insurance company. If the insurance company doesn't approve it, then you have to pay for it yourself. You need to be cash pay. Your doctor makes the appointment at the clinic. You call the clinic. You tell them, listen, I'll be cash pay. Can you give me a discount? All these imaging departments, right? Ultrasound imaging department, whether hospital or private clinic, they will give you a discount if you are a cash pay, right? And it's not expensive. It's going to cost you $150, maybe $200. It's nothing, guys. People go to the restaurants, they eat and they spend $250 eating nasty processed food, getting fat, getting diabetes, getting fucking cholesterol. I apologize. I apologize for my for swearing. I apologize. But you get my point. People, they go watch a movie eating popcorn, nasty popcorn, right? Full of sugar, trans fat, nasty stuff. They pay $150 taking the family to watch a stupid movie. $20 the ticket now. You know, it's crazy. So save that money. These are discretionary spendings, means spendings that you can cut. Don't go to the restaurant just one time, just cut on that weekend restaurant you were supposed to go, save the money, and have a carotid artery screen one time per year, right? One time per year, what a big deal it is. Save and invest that for your freaking health, right? For God's sake. Guys, Dr. B wants you to get to age healthily, just like Dr. B, so that we can be together. It is worth the investment. Save $100, $150, even $200. Who cares? It's for your health, right? And invest it in a one time per year. It's not a big deal. One time per year, right? To check your carotids for plaques. If everything's fine, then next year you wait 12 months, you have another one. If your insurance doesn't approve it, pay for yourself, guys. Right? Instead of going to an expensive vacation, 5-star hotel, 4-star hotel, go to a 1-star hotel. Save that money, $200, and have a carotid ultrasound. Then you sleep easy and you cut back your risk of stroke by 10 to 15%, right? But remember, it's not enough. You need to cut back junk food, decrease your cholesterol, diabetes, blood pressure, blah, blah. Everything has to be under control in order to not die of a stroke. Now, the problem is not to die of a stroke. If you die, you die. The problem is the disability. All those people who do not die of a stroke, they're in a disastrous situation. Half of their body is paralyzed. The guy can't even talk. He can't even walk. He can't even use his hand. He's just, for the rest of his life, he's dependent on his wife or her husband, his kids, her kids. It's a disaster, a disaster. The disability that comes out of a stroke is a disaster. And most of them, even after many years, they barely recuperate a tiny percentage of their function. The guy is on a wheelchair. He's bedridden. It's a disaster. They can't do anything anymore. That's it. So his dream of retiring healthy and traveling, going to Europe and blah, blah, blah. The dream is gone, guys. Guys, I'm a medical doctor. Follow my advice. Follow my guidance. Don't fall for all these lies, right? That if you buy this, you're going to do this, you're going to become like that, and rejuvenation, and you're going to cut back on your diabetes and blah, blah, blah. The number one way to cut back on high blood pressure and diabetes is to zip the mouth, right? As long as you'll be overweight and you keep eating and all this stuff, guys, it's just not gonna, you're not gonna be healthy. You're gonna have to take all these medication for diabetes, high blood pressure, obesity, being overweight. It's crazy, guys, what people do to themselves. I just don't get it, guys. I see a lot of patients every day at the clinic. I don't understand why people are committing suicide like that. Do not do that to yourself, guys. Invest in your future. It is a pleasure that is not worth it. Don't be like my sister, like my family members, saying that food is a pleasure of life. We need to enjoy food. But you're not enjoying anything. You're committing suicide. Food should not be the center of your life, the center of your universe. What you do for society should be the center of your life. Your job, your skills, right? If your job is boring, then learn a skill, learn a language, learn something else, do something, volunteer at the church, volunteer at the hospital, volunteer at the mosque, volunteer at the synagogue. Learn mathematics, learn to play chess, do something else than constantly thinking about going out to restaurants and diners and blah, blah, blah. Food for Dr. B is in a little corner of my life. Food, I eat just one time per day. The rest, as I said, is just little snacks. You have to put food not at the center of your life, but in a little corner, guys, because you're not enjoying life. You are killing yourself slowly but surely. After the age of 40, 45, 50, you need to zip it. And believe me, your blood pressure will return to normal, your diabetes will disappear, your high cholesterol will disappear, you will sleep easier at night, just like me, like a baby. I put my head down at 9 o'clock at night. After a few minutes, 2 minutes, I'm gone, and my brain wakes me up at 6 o'clock in the morning automatically, every day, no exception, right? And then you go to the gym, you exercise at least an hour a day, for God's sake. Cut back on materialism, right? Cut back on stress in your life, right? And believe me, you're going to feel so good, so good, so good, and you're going to live a long, healthy life. I will never retire because I love medicine. I love to work in medicine. I love my patients. I'm going to keep working until the age of 100, God willing, we'll be together. But if you want to retire, at least you can retire healthy and not be like 30% of Americans who retire so sick that they do not enjoy retirement. The guy has a ton of money, the woman has a ton of money in the bank, but they are so sick, right, that they don't enjoy retirement. Sickness because of cancer, heart disease, stroke, kidney disease, kidney failure, blah, 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 heart failure, heart attack. I mean, it's crazy, right? Don't be among those. I love you guys. Whoever the Katso you are, whatever your religion, your ethnicity, your race, your gender, whether you're a man, woman, anything in between, Dr. B love you as much as he loves medicine and health sciences. Get back to me if you have any questions, any comment. I promise I will get back to you. It might take some time, but I will get back to you. I love you guys. Get back to me. Put your question down there. Anything the Katso you have to say, I will get back to you. I love you all. Talk to you in the next video. Bye-bye.